Hi, so in this video, I'm going to be telling you about 5 highly paying non-clinical healthcare jobs in the UK. So what do I mean by highly paying non-clinical jobs? So these are jobs that you're going to be working in a healthcare facility like a hospital or a nursing home, but you don't have any direct patient contact. So you're not caring for patients, but you're working in a healthcare facility. And look, the best part about these jobs is that you don't require any experience and you don't require any qualifications and you don't require any degree whatsoever to do any of these jobs. So these jobs, with all the jobs I'm going to say, all of them pay more than £26,000 per year, which is a lot of money. You know, when just to put this into perspective, if you're working as a carer in the UK, you're going to be earning £20,000 per year. And the maximum you can ever earn in your entire career as a carer, let's say you remain in that position, is 21,000. And that's why I keep saying you don't only have to apply for carer positions. There are many other options that you can apply for, but it's just about you opening your mind, you exploring those opportunities, and you knowing that those opportunities exist. And look, that's why I'm telling you right now, so that you're aware, so that when you're doing your job search, you can look. So let's get straight into it. So basically, by the way, if you're new to the channel, you're welcome. Lovely to have you. Make sure you hit subscribe, turn on the notification button because you want to be notified when I drop a video every time. If you are a returning subscriber, again, it's such a privilege, you know, having you here always. And again, if it's our first time meeting, my name is Melvis. I work as a nurse myself for the NHS. I'm an advanced nurse practitioner, and I also have a private coaching program where I support with getting these jobs for nurses, carers, student nurses, as well as career progression in the UK. So now you've got your first job in the UK, then what? You know, if you want to progress, I'm your girl. You're looking for a job, you think, oh, I want to work in healthcare, I don't know what to do. You need to get in contact with me, check out my private coaching program, and make sure that you join. So let's get to these jobs. So these jobs, like I've said, I'm going to give you 5 different jobs. So 3 of these jobs, basically, you can earn more than 26,000 per year. And 2 of those jobs, you can earn more than £33,000 per year. Yes, you can earn more than a qualified nurse, yet you don't need any experience, no degree, no qualifications. But there is a but. Before I tell you these jobs, let me tell you where to find them. NHS Jobs website. That's where those jobs are. You need to make sure that you're checking the job description and person specification thoroughly to make sure that, you know, it's what it is. So that's what I'm going to say. So make sure that you're doing your due diligence to do the research. So let's start with the first job. So the first job is in procurement stores. So basically, for a healthcare facility to run and to function smoothly, you need supplies, you need food, you need soap, you need clothes, you know, you need bed sheets, you need everything. You know, it's like a house. For a house to function, you need to be doing shopping. So a healthcare facility is the same. For a hospital to run or a nursing home, you need supplies. So the people that do those supplies, procurement and stores in the NHS, for example, they are paid band 4, and band 4 you can earn in excess of £26,000 per year. So what they do is they actually order the things that are needed from obviously the external suppliers. They have the list of approved external suppliers. So you know, you just have to order the things from them. Once they deliver the things, you have to take the stock. You know, you do an inventory. What have they delivered? What did you you know, order? Is there anything missing? Is there anything that is in excess? Which wards need what? You know, if it's equipment, for example, theatre equipment, you need to deliver it to theatre. If it's food stuff to take to the ward, you need to take that food stuff to the wards. So these jobs are very well paid. It's got nothing to do with patient care. You don't have to have anything to do with nurses, doctors, carers. You know, we are the ones that do all the clinical work. These people are just making sure that they order the supplies that the hospital needs or the healthcare facility needs in order to function. So procurement and stores, obviously different trusts or different hospitals will call it different names. So you need to really look at that job description and person specification, like I said, to make sure that, you know, that is what it is. And you don't need any experience whatsoever for this job. You don't even need any qualifications, neither do you need a degree. So this is a huge opportunity, because I know that being a carer is not for everybody. That's why I'm bringing you these opportunities, so that you can also have other things to apply for, rather than feel like the UK is only recruiting carers. And look, another tip for you: many of obviously these jobs, you're able to have visa sponsorship, because if you're working in a healthcare facility, those healthcare facilities already have the license to recruit overseas. So they always say that once you find the right candidate, they're always willing to provide that, certificate of sponsorship. So you want to make sure that you're applying for those jobs, and presenting yourself in the best way possible, because any job that doesn't require any formal qualifications, the job is highly reliant on you being able to present yourself in an excellent manner. Otherwise, obviously, you're not going to be getting the job. So that's the first job: procurement, stores, ordering stuff and things. You've already heard how much you can earn. The second job now is maintenance, equipment. Look, again, a healthcare facility cannot run without equipment. So a hospital, for example, has beds, you've got hoist, you've got different types of machines, you've got different types of, equipment that you're using, whether to support patients or even just to move, different things like the procurement that we talked about. If they're doing the deliveries, you're not going to carry the things on your hands, for example. You're going to have maybe there's small cars that they use, to deliver the things. I don't know what they're called. They have a name, but I've got no idea what those small cars are called. They can drive them along the hospital corridors, for example, to deliver all the different things that are dropping at the different wards. They've also got trolleys. So all those things, they do get broken very frequently, and they need to be maintained. If a bed is broken on the ward, you need somebody to come and have a look at it. So those people, the maintenance people for that, equipment maintenance people, they earn in excess of £26,000 per year. And look, you don't even need any particular experience or any particular skill or degree to do that job, because it's maintenance. And if there's an equipment that is very sophisticated, what usually happens is that that company that is supplying the equipment will have their own staff that are doing the maintenance. So that company obviously will have trained staff that if the equipment is broken, as nurses or whoever is there can ring the company and say, look, this is broken. Or if you tell the hospital maintenance people, they can then contact, the particular company. So again, for this particular role, you don't necessarily need to have any degree to do that. And many hospitals are paying band 4, which is you can earn in excess of £26,000. So you want to make sure that you're checking for these opportunities, because look, there's more to it than meets the eye. And again, if you haven't subscribed to the channel, do hit subscribe, turn on that notification button, because I drop a video every single day on YouTube, because I want you to succeed. I want you to excel. I want you to thrive. I want you to know what the highest paying jobs are, because I want your life in this country to be on sleek. I want you to have a beautiful life with your family, so that you can, you can feel like if you're an immigrant, for example, you can really enjoy your stay here. That's my purpose. You can enjoy your time here, rightfully so. So please leave a comment saying, Melvis, I will implement, because I don't want to be wasting my time doing this video for you and you just watch it and it's like another YouTube video. Neither do I want you wasting your own time watching the video, yes, with no implementation. So please leave a comment below and say, Melvis, I will implement, because I'm going to hold you accountable and say to you, you said you were going to implement. Have you applied for the job or have you not? So that's the reason for this implementation, and I'm going to be keeping an eye on you. So do leave a comment below and say, I will implement. So that's the second job. Now let's move to the third job. So the third job is working as a personal assistant. So when you're working as a personal assistant, this is admin. So this is, an admin job. So basically, senior doctors and senior nurses do have personal assistants, or, well, not only doctors and nurses, because you've also got, obviously, the hospital management CEOs and all of that. They have personal assistants as well. So these personal assistants, in some trusts, are paid from band 4 and above. You don't need any degree, you don't need any experience, you don't need any qualifications to apply. Just your humble self, being able to access a computer, how to log in, skills like Microsoft Word, Microsoft Excel. Those are the main skills that you need for this particular job. You can use a computer, you can use a spreadsheet, So these are tips that I'm giving you now. So if you're applying for these jobs, you want to include all of this, in your CV and your personal statement, obviously, once you've learned them. If you don't know them, you need to learn them. But that's all you need. How easy is that? You could even learn all of that in a day. And that's all you need for this job. And you can earn over £26,000 per year. And the best thing about this particular job is that not only can you earn so much money, but also you can progress really quickly. Especially if you're very good, you can really progress just by doing in-house courses. So you don't need to go to the university. You just do courses, You know, as you're working and progressing, you're doing small courses. You do 1-day course here, you do a 2-day course here, you do a 3-day course here, and look, before you know it, you're already earning £50,000 or £60,000. And that's how many people that work in healthcare, they're earning 60,000, 70,000. They have, in fact, with no experience, very, very young people. And that's because they have chosen these careers that are non-clinical. They have like a really, really good career pathway to follow. And the thing is that if you're a nurse, you know, or you're a carer, it's not easy to progress, or a doctor. These are the most difficult jobs in healthcare. You're going to be dealing with direct patient care, but yet to progress is going to be so, so tough. But you have the non-clinical staff that, you know, they don't have any direct patient care, but they have excellent pathways for career progression. They end up earning triple what we earn as nurses and carers in a short period of time. So when you're choosing your healthcare career, if you want to work in healthcare, you need to make sure that you're thinking, obviously, deep and wide, far deep and wide, because yes, there are many reasons why you would choose one profession from another, but just make sure you're exploring all the different avenues that are available and all the different opportunities. So that's really what I'm trying to achieve from this video, just to let you know that there are other options in healthcare that you can explore. You know, that you can expand. By the way, if you're enjoying this content, like the video. It's just going to make me know that you're enjoying content like this, so that I can do more videos like this, because I only do videos for things that people are asking me. If I'm getting so many questions about something, just because it's easier, I just do a video about it so that many people can benefit from it. But obviously, if you want to work on a personal level with me, you need support, that one-to-one support to apply for these jobs. Then, you know, I really only support people that are part of my private coaching program, because, you know, I need to be organized, I need to stay focused, I need to have that undivided attention. Otherwise, it's not possible. Life is just not sustainable. There's too much to do. And look, it takes quite a lot of time as well applying for these jobs, because you need to go through the job description, person specification. You need to look into your own skills that you've got. You need to be able to find the skills that are relevant for that particular job, because you're competing with other people. You know, nobody's going to pay you 26,000 just like that. You're going to be competing with other people. So you want to make sure that your own application is the best. You want to make sure that you stand out from the crowd. You want to make sure that, you know, when somebody looks at your personal statement, they're like, oh my goodness, Melvis, you're exactly what we need for this job. You know, that is the objective. So, you know, again, you can apply by yourself. Like I said, go to the NHS Jobs website. That's where you apply. But if you're part of my private coaching program, then I can actually support you, you know, through this journey, through this process, to make sure that you get those jobs and continue to progress. So this is something that, you know, you should be thinking about, you should be considering, especially if you've got some experience, obviously, in healthcare. It just puts you again in a better position, obviously, because you've already got that idea about the healthcare facility and how it all works. So it's going to put you again in a better position. So now let's move to the third job. So the third job is one that I hold really, really dearly. This job is something that when I found out how much it was being paid, I was like, what? You mean as a nurse, you know, as a nurse, as Band 5 nurse, I'm earning less than this job? But let me tell you. So the job in some hospitals is called bed coordinator. In other hospitals, it's called capacity. In other hospitals, so it's got different names in different hospitals. Different names in different hospitals. But basically what these people do is that if a patient comes into the hospital, let's say I'm working on ward A as a nurse, and a patient is admitted, so that's a brand new patient that needs to come to my ward, and I get the name, and they say, oh, Melvis, you've got Mr. Smith, who's got abdominal pain, that you to come to your ward. Mr. Smith is just a random name that I'm using, obviously not a real patient, you know, for confidentiality and all of that. It's just a random name. So if I say, oh, I've got Mr. Smith, I need to contact a bed coordinator. So this is this role. I contact them and I say, look, I've got a patient that is due to come to my ward. Can you please, you know, can you please allocate a bed for them? Or if you've got somebody that needs admitting, again, you call them and you say, this patient needs to be admitted into hospital. Can you find a bed for this particular patient? And then they will do that. So these people, can you imagine, in many NHS hospitals, they are actually paid over £33,000 per year as a starting salary. £33,000 per year. You don't need any degree, you don't need any experience, you don't need any qualifications at all. All you need to do is see a vacancy, apply, do the interview, be successful. That's it. As nurses, 70% of nurses are going to remain band 5 forever, which means that for the entire career of that nurse, that person is going to never be able to earn that amount of money. But if you're capacity or bed coordinator or whatever they call it in your trust, many of these people are earning over £33,000 per year. It's unbelievable. I'm like, when I found out, I was like, oh, really? And just talking about this, actually, there was one girl who was part of my private coaching program. Her mom had come from the Caribbean, actually. That's where her mom had always wanted to be a nurse, but because of family situations and things, she wasn't able to do nursing. So she was so keen for her daughter to become a nurse. She was so passionate about it. She's like, oh, I want my daughter to become a nurse. Her daughter was 21, obviously in the UK, that they now live in the UK. So the daughter wasn't keen on nursing, but the mom was like, oh, nursing is good, trying to give her the advantages. So she found my post on Facebook. The mom found my post on Facebook, contacted me. She was like, oh, Melvis, I'm from the Caribbean, I've been in the UK, XYZ. I want my daughter to study nursing. She doesn't want to. And I was like, okay, I'll have a chat with your daughter. So I had a chat with the daughter. She was like, oh, I'm not keen on nursing and this. But obviously, we all know the advantages of studying nursing. There are so many of them. So the mom was so keen. She then enrolled her into my coaching program. And I decided that I was going to get the daughter to have experience in healthcare, have a non-clinical healthcare position, so that she could just try and see what the environment is like. Because she was worried about blood, she was worried about this. So when she said that to me, I said, well, look, you've got really valid reasons. Why don't we try, we'll get a job for you in healthcare where you'll be working in a hospital, but you're not going to have patient contact, but at least you'll be in that environment and you can see how you feel about it. And that was the best suggestion that I ever had. This has been one of the biggest success stories from my coaching program. And in fact, I've had a chat with her. We'll be doing a YouTube video very soon together so that she can share her experience and just encourage and motivate other people as well. So she agreed to that, and we started looking for jobs online, and I found this bed coordinator job, band 6, paying £33,000 per year. We applied for it, and guess what? She was successful. She got the job, and it was just so amazing. A 21-year-old starting up, we just said, try this just to put your foot in the door in healthcare, see how you feel. She got a job straight away, band 6 job. Just to put this into perspective, as a nurse, to get to band 6, you have to study nursing for 3 years. You need to get an NMC PIN number. You need to work as band 5 for many years before you ever get to band 6. It's a long journey, and many nurses never make it to band 6 because there's no support for career progression. This girl was able to get this job paying band 6. And right now, just to put even more context to this, I'm currently working with her to get a band 7 job, because the hospital where she's working has got in-house training that she's been doing, like small courses that she can do to progress as a team leader where she's working, and that will be band 7, which means she's going to be earning £38,000. She's 22 years old now as we speak. She's been doing this job for a year. It's unbelievable. And obviously now she's like, hey, no need to do nursing. I'm loving the job. And obviously there's no need, because if she goes back to nursing, there's no need. She's just going to progress now from here. And so even though, the mom was very keen on nursing, now she's like, oh my God, Melvis, this is so amazing. It's actually really turned things around for her, because she's worked out brilliantly for the girl, because she hasn't had to do nursing, but yet she's in a beautiful role that she enjoys, highly paid in healthcare, a stable job with the NHS. And her mom also knows that her daughter has got that job, that, she's got a secure job, because that's the whole point. And this particular job, so you need to check again, if you're applying for it, check the job description, the person specification, check the banding. I've also seen an NHS hospital that is paying band 4 for this particular job. So band 4. So band 4 is obviously you earn in excess of 26,000 as you're progressing. That's how you earn. But there are many hospitals that are paying band 6 for this job, and there are many other hospitals that only use nurses for this position. So you need to check well when you're obviously applying. Some hospitals say that you don't need to be a nurse to have this job, but obviously it's still very highly paid. Other hospitals only use nurses for this particular position. So again, just check, but it's one of the highest paying non-clinical healthcare jobs that requires no experience, no skills. Well, it does require skills, obviously, but you just need the interest. It's unbelievable how much, some of these non-clinical jobs are paying. Even like in IT, They are very, very highly paid. I'm going to do a whole video just on the IT part of it. That's why I kind of left it out of this video. It's on purpose, which is why I only wanted the 5 healthcare jobs. So keep an eye on the channel. If you haven't subscribed, do hit subscribe. Turn on that notification button, because I'm going to be doing a video on the highest paying, IT related jobs in healthcare, and you will be shocked to find out how much some of these jobs are paying. And many of them only need like maybe a certificate that you do for 2 weeks or a month or 4 months or 3 months, and you can even have a job that pays over £60,000 per year. Yes, £60,000 per year, and all you need to do is just a course for like 3 months or 3 weeks. So it's unbelievable. There are lots of opportunities. So now let's move to the 5th job. So the 5th job, again, is a job that I hold very, very dearly, and it's in recruitment. So as you know, healthcare is constantly recruiting. The UK is constantly recruiting. You constantly need new staff. As other staff are leaving, new ones are coming. You need somebody to coordinate this recruitment, obviously. So you have recruitment coordinators. In many hospitals, guess how much they're being paid? Over £33,000 as a starting salary. Oh yes, in many NHS trusts, that's how they are paid. Because you need to realize that if you're recruiting overseas, just to give an example, if you're doing overseas recruitment and you're using an agency, you can pay that agency a lot of money for each nurse that they recruit for you. But if you recruit your own staff, imagine that if I recruit somebody to coordinate the recruitment, do interviews and all of that, if you pay them £33,000 per year, you're saving a lot of money from having to pay agencies, to supply staff. So many NHS hospitals are moving away from using agencies to actually recruiting their own staff themselves. And so they have to recruit a team of people to do the recruitment for them. And this recruitment team is very well paid in many hospitals. Some hospitals pay band 3, some pay band 4, but many hospitals pay band 6. So if you're looking for this job, look, you don't want to cut yourself short. Look for the hospitals that are paying the highest, because that's the whole point of it. I don't want you to go and apply for a job that pays, £26,000. If you can get the same job in maybe another hospital that is going to pay you £33,000, because if you're starting your career earning £33,000, if you progress to the next stage, you're going to go to about £38,000, £39,000. That's why it's important, because the higher you start, obviously the higher you're going to go even quickly, because if you even just progress one step higher, you're going to go to band 7. So this is very important. I've seen, and there are many adverts all the times on NHS jobs, especially with the introduction of the red list countries. Many NHS hospitals have actually realized that if they are recruiting staff directly, it's very, very cost effective. They are not spending so much money because the nurses are applying directly. You've got your own in-house team that is doing everything for them, and so you're bypassing the agencies and just doing it all yourself. Even nursing homes, many nursing homes as well, they do their own recruitment themselves. So again, you want to make sure that when you're looking for jobs in the UK, if you're in the UK, obviously just check out these jobs. If you don't require sponsorship, that's even easier, that's even better, because then you just have to apply for the job, do the interview, and get started. If you do require sponsorship, do make sure that you still apply, because there's always visa sponsorship available to the best candidate. Again, with recruitment, you'll be doing coordinating recruitment. If you're somebody who is really passionate about recruiting people, or you've got experience even, or even if you're a nurse, you could still be a nurse. This is also a career progression pathway for nurses. So you need to make sure that you're looking at these other extra opportunities. And if you're part of my coaching and mentorship program, again, I have a course that is there that walks you through different pathways for career progression. Again, if you join my one-to-one program, we'll go through what's best for you. What are your skills? What are your needs? What jobs should you apply for? Once the jobs are found, I can actually then support you. Look at your personal statement, look at your job application, ensure that you meet all the requirements that they are requesting and that they want, because that's what you really need in order to succeed, in order to excel. But obviously, I've only selected 5 jobs. There are many other highly paying healthcare jobs in the UK, both clinical and non-clinical. I'm going to do a similar video like this for the clinical jobs, because you may be somebody who is really keen on being clinical. You want that patient care. You want to be caring for those patients. And so it's but fair that you also find out what clinical jobs are there that are very highly paid, that don't require any degree, they don't require any experience. All you need is just your humble self, you know, ready to work, willing to work. So again, if you haven't subscribed to the channel, do hit subscribe, turn on that notification button, because you want to be the first to be notified when I drop this beautiful content that I do drop on YouTube, so that it can just help you to continue to grow, to continue to thrive, to continue to excel. Because life in the UK can be hard, it can be tough, you know, especially if, like me, you're an immigrant, it can be so difficult. So I just want all of us to have really fulfilling jobs. I want all of us to have satisfying jobs. I want all of us to live our best lives in this country, because already we've left so much back home. You know, you're probably watching this and you've left your kids, you know, you've left your husband, your wife, your parents, your family, your friends, your loved ones, your environment, to move to the UK. So you want to feel at home here, and part of that is having a job that you enjoy, a job that you like, a job that you can relate to, a job that you feel that is right for you. And pay is a big factor, because if you're earning well, especially if the job is not so stressful, you're going to feel so fortunate. You're going to feel so chuffed. You're going to feel really pumped up, filled with energy, and you're going to always feel that it was the best decision to come to the UK, you know. So that's how I feel as well, and that's why I'm constantly looking for these opportunities to bring them over to you. And do make sure that you share this with your friends, family, loved ones, so that they're aware, they can apply for these positions as well. You know, they always provide visa sponsorship for the right candidate. Again, so that's not an issue. Just do apply. If you're not sure and you're thinking, oh, should I apply? There's no harm in applying. Always apply. You never know where your luck is going to come from. Because let me tell you one secret. With many of these jobs, sometimes nobody actually applies. Nobody applies, because everybody right now is so focused on carer jobs, for example, that every other opportunity is being missed. That's why, because you've watched till now, that's why I'm telling you this, you know. Make sure that you're applying, because for many of these jobs, people are actually not applying because the focus is on carer jobs only. Everybody says, oh my God, carer jobs, carer jobs. But look, these are highly paid jobs. As a carer, you're going to earn 20,000, which is good and fair enough. But look, if it's not for you, these are non-clinical jobs that you can apply for. Because the hospital doesn't only run on nurses, carers, and doctors. The hospital needs a whole range of staff for it to run successfully. So you've got to explore these other opportunities as well, that generally come with even better career progression pathways. They come with better pay. They come with better working conditions, because most of them are like Monday to Friday, 9 to 5. You've got time with your kids, you know. You can go, if you like to go to church, you can go to church on Sundays. If you've got your parties on Saturdays, you know, you want to just chill out with your kids during the weekend, you can do that. You don't want to work night shifts. These jobs don't do night shifts, you know. So the work-life balance with them is so good. And that's why, you know, they're less stressful. Definitely, they're less stressful when you compare carer, nurse, or doctor jobs. So please do make sure that you're applying for these jobs. Leave a comment below to say, Melvis, I will implement, because I want to see you implementing everything that I've said in this video. I don't want this to be wasted. I don't want this to just be another YouTube video that you're watching. I want you to really go all in, deep dive, you know, and implement all of this. So again, watch other videos that I've done on the best jobs to apply instead of carer jobs as well. Watch, you know, if you're applying for a visa, scholarships that you can study for free. I've done videos about all these different things. Leave recommendations if you want me to do videos about other things. But most importantly, if you need that one-to-one support, do join my private coaching program, so that I can hold your hand and get you to have that accountability to be able to succeed quicker. Because it's about how quickly can you do this. You don't want to get a job in 10 years time from now if you can get it right now. And my coaching program, by the way, in case you're wondering, is just £79. So that's really not that bad. So again, keep watching.